With the summer months heating up and we're all spending more time outside, keeping our pets protected against heartworm disease.
Yes, and that is really a year-round effort. Heartworm disease is a serious disease that results in severe lung disease, heart failure, other organ damage, and will result in death, inevitably, if not treated. The worms are spread through the bite of a mosquito, and joining us to talk about heartworm prevention, because April is Heartworm Prevention Awareness Month, Dr. Brendan Sullivan, the Veterinary Operations Director over at Harris County Pets. Dr. Sullivan, thanks for taking some time with us this morning.
Hi, thanks for having me on.
All right, well, let's talk about this. It's a serious, heartworms have been detected in all states, but it's especially prevalent along the Gulf Coast. We know in dogs, there's a concern for many pet owners in this region. Tell us about the disease and just what it all involves.
Yeah, well, you started off with a pretty good summary. So as the name implies, the heartworm is a parasite in the adult life stage, lives within the heart and the blood vessels that go to the lungs. So you were absolutely right when you indicated that it can cause both heart disease and lung damage, as well as damage to other organs, such as the liver. The immature life form circulates throughout the bloodstream, and so that's why the mosquito is a really effective vector for transmitting the disease.
How do you prevent heartworms, doctor?
Yeah, that's a great question. There are a number of different preventative options for owners. So it really depends on your lifestyle and your preferences for prevention. So there are the topical spot-on preventions like we are all familiar with for flea control. There are tablets that you can give once a month that are very effective. And there are even some injectable preventatives that can last for 6 or up to 12 months. So because I'm a little bit bad about giving my dog its monthly preventative, I use that injectable, and then I don't have to worry about missing a dose or something like that. So there are really options for all types of lifestyles and preferences.
It's great, and you guys have made it easier than ever to keep your animals safe with this. Doctor, we know there's a stigma on dogs who come into the shelter who end up being heartworm positive, and it may be harder for them to appeal to a family coming in to adopt. Oh, I don't want a heartworm positive dog. But this is really a medical situation that you can alleviate, and it shouldn't deter you from adopting a heartworm positive dog.
Yeah, here at the Harris County Pets Resource Center, our shelter, we do have a program called Heal a Heart, and for select animals that might be considered already less adoptable than other dogs, we do have a program where through our wellness clinic, which is also at our facility, we will pay for the treatment, the fast kill treatment for those pets. And so the fast kill is really what gives our patients the best outcomes when they do have heartworm disease.
Yeah, doctor, I'm listening to you guys. I know Lisa loves dogs and knows them well, and I'm hearing you guys talk about heartworms. And to me, what sticks out, and I consider myself a pretty good pet owner, but it's like it's so dangerous, but yet it's so simple to prevent or fix. But for whatever reason, the message gets lost somewhere in between the two.
Absolutely. And the prevention is really the most important part, because the fix is usually, it can be painful for our dogs. There can be some side effects, and it's very expensive, unfortunately. We also have to activity restrict our patients on the fast kill, and that means that they can't exercise or enjoy their best quality of life for a good 8 to 12 weeks after the injection. So as we say in preventative medicine, an ounce of prevention is worth a pound of cure, and it's totally the case here with heartworm disease. So prevention is really the most important part of this conversation, for sure.
Amen to that, doctor. We've put 2 of our rescues through heartworm, the fast kill injections, and there were 3 injections, and it's a 60-day process, and they can't move once they've had that injection. Can you explain why it's so important to keep their heart rate down after the injections?
Absolutely. So as those adult heartworms die off, they move from the blood vessels in the lungs into the lungs. And so if they're really active during the recovery process, they can have blood clots in their lungs, and that can lead to really severe outcomes. So that's why it's, even though the treatment sounds scary, most of our patients do very well with it, as I'm sure it sounds like yours did. But we do have to take some pretty important precautions to ensure those best outcomes for our patients.
Yeah.
And what about the expense or the cost of the treatment? And maybe you can tell us how Harris County Pets and the clinic can help out with that.
Yeah, so we do have a low-cost clinic. You know, we're fortunate enough to be able to offer some of our services for less than what you'll see at most vet clinics. But yeah, because of just the cost of the medication is really expensive, and so when you're at a regular vet clinic, you know, they have to have that markup, and that's what increases the expense. So we're lucky enough, we're fortunate enough to be able to serve our community and offer those treatments at a lower cost. So it's significantly less than what you would find at your regular vet clinic, but it still can be a pricey treatment for many of our owners.
We're so grateful for the cost effectiveness that y'all are providing there at Harris County. You guys are doing a great job. And as you said, prevention is so key because treating it is expensive unless you can get into a low-cost clinic like what you guys offer, whereas prevention every month, 10, 12, 15 bucks for a chewable, or do it every 6 months. And it's still relatively cheap compared to what your pocket endures and what your dog endures in the long run, because those injections are tough. And we hope all the dogs get through it fairly well, and there's a success rate there. But we're grateful for what you guys do. And we wanted to touch on really quickly, we know you have over 400 dogs there in need of homes. What can you say about the animals that are in your care?
Absolutely. Right now, we've just experienced a large influx. We've got a lot of puppies right now. We've got a lot of dogs that have been here longer than we like. You know, these facilities are meant for temporary stays, and so our goal is really to keep animals in here for as short a period as possible. But we have some dogs who have been here for a few months, and we really want to get them out. So if you guys can come on down, if you're interested in looking at a dog, come consider finding your new family member here at Harris County Resources Center.
Hey, doctor, is this a typical influx? Is it kind of seasonal? Does you think it had to do with COVID or a little of both? What do you think?
Yeah, I don't know that the data bear out that it's necessarily related to COVID. Obviously, during COVID, we were fortunate enough to be really empty. When I started here, there were some wards that had never had a dog in it because we have this new facility. But I think part of it is seasonal, unfortunately, and there's always been a great need in Harris County for homes for animals. I don't think that really has changed, and so I think we're just back to reality. You know, all over the country, we're hearing reports of this type of influx of animals and overcapacity.
Well, Dr. Sullivan, we're so grateful to you. We know the vet life is not easy in a private practice, let alone a public shelter that is mandated to take in all animals that come through its doors. So thank you for what you're doing. Countypets.com for information, Dr. Sullivan, on the clinic, hours, pricing, and of course, all of the dogs and cats who are available.
Yes, absolutely. Thank you.
Thank you so much. Countypets.com.
Yes, countypets.com.
Heartworm preventative. We do the first of the month. Get it out of the way.
You got to put on the calendar
or
or just have it.
6 months.
Yeah.
So, thanks, doctor.
Thanks, doc. Appreciate it.